in the neck exam, basically physicians, they do a manual neck exam. They're trying, first they ask the patient if there's any tenderness. So the tenderness is a self-reported finding. And then spasms or restricted range of motions, this is what, like you feel with your hands. So you're supposed to do a very detailed examination. You check the laxity of like the spine, see if there's any palpitations and stuff. I'm actually going to explain that in a bit more detail, like in the next slide. Okay. So, however, even though previous research has shown that that neck problems alongside a concussion are actually associated with longer recovery times, I did a study in which I was like, okay, that is if neck problems are not treated, correctly. What if we actually treated neck problems like we should be treating them? So all adolescents with sports-related concussions. So this is from our registries. These are all of our patients who are like coming in. So approximately 264 adolescents were seen, and they were on average, they came to us within like 5 days of injury. So at their initial assessment, the physician, most likely Dr. Lady, you saw half the patients. Dr. Darling saw the other half of the patients. They did a neck exam, range of motion, palpable manual palpation, and then approximately 51% of all patients did not have any neck issues whatsoever, like no tenderness, no restricted range of motion. And their average recovery time was approximately 33.7 days. Okay. And then, however, approximately 49% of them did have something abnormal on the very simple neck screening exam. However, not all neck problems are the same. So according to our physicians, about only 2/3 of those neck problems were, 2/3 of those neck problems were considered mild. Now I will explain that in detail, what mild and more than mild is in the next slide. And whereas 2/3 were considered mild and only 1/3 of the 50%, so this is according to our physicians, more than mild. Okay, so if the physician thought that this was just a mild neck injury, they would ask our athletic trainer, which is Tony Soares over here. He would manage these neck problems. Whereas if it was more than mild, then for 1 whole year, we actually hired a physical therapist. So this was a salaried physical therapist, not individual assessments. And what we were trying to do is, so on the first day of assessment, if the physician did like a neck exam, thought something was a bit off, the physical therapist would come immediately into the room. So Dr. McPherson over here would immediately come into the room and do a slightly more individualized or slightly more detailed assessment, and actually start managing the neck from day 1 onwards. So using this thing, technically, even though Tony managed most of like the concussions, especially all the neck issues, there was no difference in recovery time between all 3 of these groups, which just helps us conclude if you treat neck problems properly, they do not delay recovery. Okay. However, one really, really sad bit of news from this study was that during this time when we had the physical therapist like on salaried seeing the patients, unfortunately, none of the physical therapists' visits could have been billed, because for a physician to diagnose something, they have and then recommend like a neck intervention and assessment. The neck intervention assessment cannot be billed for on the same day. So we actually ran into a lot of issues regarding billing. But if somehow we were able to fix all of that stuff, we could treat neck issues correctly. So a physical therapist's intervention and assessment of cervical dysfunction is very detailed. Here is a table from one of my publications in which I actually list down every single neck assessment neck physical assessment protocol, and which types of, like head injuries or which types of treatments, they're useful for. So if someone is interested in this, they can always read up on cervical interventions from like the physical therapist's point of view, because as athletic trainers, a lot of you can actually do most of these things. Okay, so back to my original thing versus mild versus more than mild. Most of our things are mild, it's tenderness. Our athletic trainers manage these patients, cold and warm compresses as needed, cold and early, warm and later, over the counter medications, Aleve, Advil, NSAIDs, these are things. And then lots of self guided stretches. I do not need to explain to you guys how to treat mild neck problems. You guys are the experts. However, what did our physicians think was considered more than mild? Okay, so in any situation, whenever, like maybe in their hands or things, or maybe like in their shoulders, they're complaining of pins and needles, there is suspicion, or maybe there's like a cervical spine or like a nerve impingement, brachial plexus issues. This is something that maybe our physical therapist should probably look at. If there is tenderness of the cervical spine protuberance, like this is something that we're like, okay, maybe we might need to get an MRI, you know, or something like that. We notice any cervical laxity, or basically anything that our physicians think that, oh, wait a minute, this is actually like a serious neck issue, we're gonna let our physical therapists handle that. So at the end of the day, this is a clinical decision, but the role of an athletic trainer is so important because these neck problems, the mild ones, the ones that are not treated immediately, these are the ones that actually start getting worse and worse, like over time. Because, think of this, you have a mild neck issue, it's like a bit problematic, but then, you don't really treat it, you're a bit stressed, maybe there's like a bit more stress. So your neck tenderness actually starts getting worse and worse and worse. While the longer that you're concussed. So, in my opinion, athletic trainers also play a very, very large role in this component of concussion management.